In a few minutes, turning up the juice on vaccine distribution.
Marketplace Morning Report is supported by UKG. Ultimate Kronos Group offers HR solutions to connect modern workforces. UKG.com. Our purpose is people. And by Fidelity Wealth Management, providing perspective on a client's entire financial picture. Investment minimums apply. Fidelity Brokerage Services, LLC.
I'm David Brancaccio. We'll have the December jobs report in about an hour and a half, with forecasters expecting only small gains, if any. But with vaccines rolling out and the money from the COVID relief package in many bank accounts now, could we see more jobs in the month we're living in now, January? Marketplace's Samantha Fields has that.
The short answer, not yet. For one reason, the U.S. is still setting records for new COVID infections and deaths.
I think that that's the biggest determinant, frankly. What's the virus doing?
Erica Grosjean is an economist at Cornell University. She says as long as so many people are staying home, we just aren't going to see a lot more hiring.
We sort of reached a plateau, I would say, that is not going to look a lot better until the vaccine reaches a whole lot more people.
And we're not there yet. But Heidi Shierholz at the Economic Policy Institute says the latest COVID relief package will have a positive effect on the economy this month.
Without that stimulus package, over 10 million people would have lost unemployment insurance benefits at the end of December. And that would have been a huge drag on the economy that we will not see.
And with the Democrats soon to be in charge, Shierholz says there is likely more relief on the way. I'm Samantha Fields for Marketplace.
S&P futures are up 0.4% ahead of that jobs report. It is the week that interest rates started moving up off their pandemic lows. The 10-year benchmark is up at 1.09% now. A flight attendants union says that people who invaded the U.S. Capitol should be banned from boarding flights because of safety concerns.
When the door closes and we're up in the air, you can't call for help. You can't run away. You have to deal with the problems there.
Sarah Nelson is with the international she is the international president of the Association of Flight Attendants, CWA, which represents people at 20 airlines.
If there are people who are confirmed to have breached the Capitol, to have broken and entered our United States Capitol, that they are a risk. They went there with the purpose of doing harm and attacking our government and the institutions of our government. And many are calling this domestic terrorism. And we have a practice of keeping people with intent to harm others and intent to harm the U.S. government off of our planes.
American Airlines had banned alcohol service on flights to and from the D.C. area through last night. Not listening to airline crew is a federal offense with a fine of up to $35,000.
Marketplace Morning Report is supported by C3.ai. C3.ai software enables organizations to use artificial intelligence at enterprise scale, solving previously unsolvable business problems. Learn more at C3.ai. And by GEP, helping transform supply chains with strategy, services, and software, including GEP Smart and GEP Next, AI-based digital procurement and supply chain platforms. And by Cabot Creamery, a farm family cooperative since 1919, crafting traditional cheddar cheese, offering comfort recipes and educational resources at cabotcheese.coop.
Now to speeding up coronavirus vaccine shots after what's seen as a slow start in many places. Experts say some of the delay may have been the federal money to help states with this took so long to get approved in that stimulus bill in Congress. There was also 2 weeks that pharmacy chains needed to organize vaccine shipments that they're contracted to administer in nursing homes and other long-term care facilities. But there's more. As part of Marketplace's ongoing Fast Track series about the challenges of distribution, I wanted to check back in with Dr. Kelly Moore, Deputy Director of the Immunization Action Coalition. Thanks for doing this.
It's great to be with you again, David.
Where are we with this? I mean, a lot of headlines about a lot of vaccine already out there, but not a lot going into people's arms. Does this surprise you?
I think that some of the promises made by federal officials were truly aspirational, but really unrealistic. If you've been in this business as long as I have, you know that there's a lot of work to do to start rolling out a new vaccination program. So it's not surprising that we're getting a slow start, but we should see things improve in the weeks ahead.
Now, we do really got to get on the stick here. Lives are at stake. Any recommendations for how we could rethink a little bit of this?
I think a couple of things would be helpful. One of those is going to be getting people experienced with giving these vaccines and with scheduling them. The other thing is that I'm hopeful that additional funding to public health will allow public health officials to start setting up publicly accessible large-scale vaccination clinics with the additional resources coming soon.
I've noted that who gets vaccinated when really does vary by state. This is the tradition even before COVID-19 that the CDC recommends but doesn't mandate.
That's right. But in public health at the state and local level, we consider their recommendations nearly scriptural. They're generally supported by the best available evidence. And so traditionally, we've been able to really hang our hats on their recommendations.
But this time it seems different. Even though there were always recommendations, this time some states are saying, no, we can figure this out ourselves.
Well, I think over the last year, there's been a lot of confusion about various aspects of the pandemic and the response to the pandemic, whether it came to testing and how testing was done or contact tracing. And states have felt like CDC wasn't providing enough guidance or perhaps the best guidance. There were questions and concerns about political influence on that guidance, and that undermines the credibility of this incredibly important agency. And I think we're seeing the results of that in states choosing to go their own way instead of following these guidelines. And it does create more confusion when one state is doing something different than the state next door. So my hope is that we can restore trust in CDC and restore our ability to cooperate across state lines.
Dr. Kelly Moore is Deputy Director of the Immunization Action Coalition based in Nashville. Thank you very much.
Thank you, David.
All of our Fast Track coverage accumulates at marketplace.org. Our executive producer is Nicole Childers. Our digital producer is Alex Schroeder. Our engineers are Brian Allison and Jay Siebold. I'm David Brancaccio. This is the Marketplace Morning Report. From APM, American Public Media.